welcome to the David Goodman Reality and Truth Show. My name is Vanita Lambert, and I'm the host of this show. I have the honor of hosting this show every single week, and I get to bring on assortment of guests, just a variety of guests in a variety of different areas to give information to the community for every category that I could think of. We are a resource for the community. And today we're going to be talking with a guest, a very special guest, and a colleague of mine, Alicia Burno. She's been here before. We're going to try to do it, and she's bilingual. So we're going to try to make it for our English and Spanish speaking audience, and we're going to be talking about something really new, and it's new to me. I really don't know much about this category, but she does. It's called Oak Street, and it's a facility that they're bringing to our community to help our clients in so many ways. So first of all, Alicia Burno, thank you again for coming on the show.
Thank you, Vanita, for inviting me.
And she'll be back many times because this is my partner.
Thank you.
So if you could just reintroduce yourself a little bit to our clients, I'm so client-oriented, to our audience again, and just tell them a little bit about yourself.
Yes, good afternoon. My name is Alicia Burno, and I am a licensed insurance agent. So I'm here to talk with Vanita about this new clinic, Oak Street Health Clinic, that is going to be opening soon. Actually, one is already open in one facility, but it's going to be opening soon. So we want to talk about that and, how you guys can benefit from this clinic. Buenos días, mi nombre es Alicia Burno, soy licenciada en seguros. Y estoy aquí con mi compañera Benita y vamos a hablar acerca de Oak Street Health Clinic. Es una clínica que está abriendo sus puertas pronto en Connecticut, pero ya abrió una en Waterbury. Así que vamos a ver qué es lo que nos va a ofrecer esta clínica para todos nosotros.
And so, Alicia, one of the things that you and I both have been trying to do in this area is I've been trying to schedule a seminar, a Medicare seminar in Bridgeport, Stratford, in the greater Bridgeport area. And I'm trying to do it at the Newfields Library, and I'm looking at the Burroughs Community Center. I'm still waiting for people to get back to me, but I think if I can get it, a firm date, it will be the end of September or the very beginning of October. So I just want to put that out there, that we are trying to get that seminar set up. And we're going to be talking about Oak Street as well as Medicare during the seminar.
Entonces estamos viendo aquí, Benita está viendo de organizar un seminario para hablar acerca de Medicare y hablar acerca de la clínica de Oak Street Health Clinic para todos. Ahora, todavía no hay una fecha estable, pero se está tratando de ver que sea como para finales de septiembre, principios de octubre. Todos vamos a estar anunciando eso para que todos sepan de este seminario y puedan atender. Va a haber mucha información muy buena.
So, Alicia, I did go on the Oak Street tour in Waterbury, so I got a little bit of information, and the information that I got is just wonderful for our clients. It appears to me that Oak Street is going to be your one-stop shop. You're going to have your primary care doctor there. Mm-hmm. You'll get to see all your specialists. They will schedule your appointments, and when they schedule your appointments, they ask if you need transportation. I mean, what else is there, Alicia, that I'm missing? Because you've done an actual seminar there, right?
Well, I've been meeting with these people and helping them out actually with translation.
Okay. We're still in the learning stages and getting everything together.
Yes.
Like she said, they only opened one, but it sounds like it's going to be wonderful.
I actually met one person from Oak Street Health Clinic 2 days ago, where he explained to me that they're opening 4 locations: Bridgeport, New Haven, New Britain, and Waterbury. Waterbury is open already.
Okay.
And New Britain is going to be opening October 20th. That's their tentative date. And then the other ones too, more or less. But they're opening one at a time. So let's see when they're going to finish opening them all. But there are 4 locations so far in Connecticut. Now, what they are still working on is getting the doctors.
Okay.
That's why they are not opening in New Britain yet. It was supposed to be next month, but they still don't have the providers.
Okay.
So they're still working on that.
So let me ask a question. So they're working on getting the providers. So if I have, say I'm 65 and I'm just signing up on Medicare, do I go through Oak Street for my Part C, for my Medicare Advantage, or do I just get it from Aetna or United Healthcare? How does that work? That's the part I don't know.
Well, they are going to have a team of people
Okay.
on site. It seems like it's going to be practically all day, Monday through Friday,
To enroll?
to help people look for health insurance, for the
okay.
Medicare Advantage, they're going to have agents, and they're recruiting that, they're going to have like two time frames. Like I think it's like between 9 and 12, and then 1 to 4. I think so. And they're recruiting. They want to know which agents can help them out. Stay there on site. So when they have the need, a client has a need, one is there to help them.
See, I didn't understand that part. I thought we had to enroll our clients and then bring them there for the services.
No,
Oh,
no. They would like to have an agent there to help the patients that come in.
Well, they could count on me for Bridgeport.
Yeah.
I'm getting up there, and I had said to you, I was going to sit at a Walmart.
Yes.
Remember I told
yes.
you?
Yes.
Because
yes.
what we do is we drive anywhere in Connecticut, sit at your kitchen table, and, help you enroll on insurance, Medicare, life insurance, or whatever. And it takes a toll. It's taking a toll on me.
Yeah.
So I would like to just be in one place for a while.
Yes.
She's a lot younger than me, so she could do that.
What they're also working on is actually in the agreements with the companies, with the insurance companies. So they already got agreement with Aetna.
Okay.
So Aetna is in. And I know that they're going to be working with Anthem, and they are pretty new. So they are really trying to see, with which companies or health insurance companies will be good to work. Like who has
the most providers,
the most providers and clientele.
The biggest network.
So the biggest network of clientele.
So they're also accepting existing, say for example, it's Aetna. We're just going to pick that. Well, I'm not saying for sure, but say if it's Aetna, they're picking existing Aetna clients as well that are 67, 68, or whatever.
Oh yes.
So how do you bring them in?
That is a good question. How are they bringing them in? They are actually doing special activities, in the area. So I know they are moving around. They're trying to market their, the clinic, different senior centers, different places, get to know them, so people get to know them.
Okay. So I'm going to have to get you to hook me up with somebody so that I could, help them market, go to some of these centers, or have them come to our seminars, and hopefully I'll be a resource for the greater Bridgeport area. That's what I'm looking to do.
That would be a very good idea, and actually I can put you in contact with this person who is the one who is taking charge here in Connecticut.
Oh, okay.
Yes.
Yep. And once
you can bring them to the program.
Yeah. Once I get all the information and know 100% of what I'm doing, I will bring it to you.
Yes.
And hopefully, I heard Bridgeport was going to be opening in the fall. That's not sketched in stone because every time you implement a new plan or program or a computer program, there are always glitches
Yes.
and setbacks and things like that.
Yes.
So I'm
And it's also
hoping for the fall.
Yes, and also the agreements. You know, you have
yeah.
to find the providers, you have to get the agreements with the insurance companies. Takes time.
It's a lot of moving parts.
Yes.
And negotiating, and everybody has to be on board because you want, once you offer it to the clients,
Yes.
you want to make sure that it runs really smoothly.
Right.
And I can tell you the little bit that I do know about it, and what I really like about it is that it's going to be like more like a one-stop shop for the clients.
And you know what they also say is that they're going to help people in a way that you don't find nowadays. Doctors are really going to be dedicated to you. There's not going to be laptops in the room. They're going to be really a one-on-one dedication to the client. Yeah. And what they say too is that their goal is actually to keep you healthy. It's not to wait until you are sick in order to do something. No, they
right.
want to follow up and keep you healthy, keep you out of the hospital.
Oh, yep. Better personal care.
Yes.
Because let's be honest, there's a shortage in the medical field. And sometimes you have to wait a very long time for an appointment.
And that's something that they said. Nowadays you have to wait for months.
Yeah.
For an appointment. They are actually offering appointments the same day or the next day.
Okay.
So that's good, right?
So if you have an emergency, a lot of people, since you have to wait so long for the appointment, if you have, I don't know, maybe muscle spasms or something in your body's going wrong and it's making you nervous, and you call the doctor, you try to get an appointment to get the doctor to check it out, and then you set the appointment for a month, and if it's going to take that long, you end up in the emergency room. So this system is to prevent that.
Right.
It's giving you better personal medical care because all of your doctors, your primary care doctor, your specialists are, in my understanding, may all be in this one facility.
That's something too that they are offering.
Is that correct? Or
right.
Yeah,
No,
okay.
you're right. But something also that they are offering that not all the other doctors offer is transportation.
Oh, that's right.
They will bring you to the clinic and they will return you to the clinic.
When they make your appointment, they ask, do you have a ride?
Yes.
And that's when they set it all up.
Yes.
That's awesome.
It's great because there's so many persons who have a problem of transportation.
Exactly. Now, I'm sure they're going to have transportation with the disabled van and all of that because some people are in wheelchairs, some people are in scooters and stuff like that.
I'm sure they will.
Absolutely.
I'm sure they will. Yes.
That's wonderful.
Yes.
I can't wait for this.
Yes, me too. Me too. I mean, they already opened Waterbury office. Soon will be New Britain.
Oh, I can't wait for it for my clients because they're going to be taking really good care of you. And I can't wait for it for me because I can sit in one spot for like 4 hours.
Yes.
That's a really good thing.
Yes.
And everybody should be preparing for our annual enrollment period.
That's
It's going to be
right.
starting in October.
That's right.
October 15th to December 7th. And we're going to be meeting with all of the vendors, Aetna, Anthem, all of those guys next month.
Yes.
In September.
Right.
And
Right.
we'll be finding out all of the changes, so you'll be getting your annual notice of change.
Right.
And that's the time for you to review what you have, review the changes from 2024 to 2023, and see if there's any changes that you'd like to make.
Yeah.
Make sure your medications are still covered, your doctors are still in the network, and give us a call.
Yes, I
If you
heard
don't-
that some
Yeah.
plans are going out of business.
Exactly.
So
Which
we
plans
have
are those? Do we know yet? Or
No, I don't know. I just heard. Let's see what is coming up.
Yeah, and you don't want to wait. And if they are going out of business,
Yeah.
you don't want to wait until January. You find out, oh, my plan went out of business,
Yes.
and you need to go to the doctor.
No plan.
I know you have no plan.
Yes.
Unfortunately, things like that are out of our control.
Right.
That's why it's important to give us a call. You have our phone numbers here. We'll be happy to, speak with you over the phone. We could do verbal appointments. We could, invite you to our seminars, and we'll go to your house too if we really need to help you.
Right.
Okay. Right, Alicia?
Right. Right.
So what else is coming up with Medicare?
Well, just let's pay attention to the changes, definitely. What comes new, what's getting old, what's going out, and let's pay attention because we want to be covered. I mean, we want our medication to be covered, we want our doctors to be covered. It's important, right?
Right. And there's nothing you can do until the annual enrollment period.
Yes.
And then it will be effective in January. But what I would recommend to some people, and this is something that I do just when I go to the doctor, if you're thinking about it, just, have your little whiteboard on the refrigerator or your little notepad. And if you have any questions or you hear of anything coming up, just make a little note of it. Okay. And then when you get a representative to talk to, you'll be prepared with your questions on what to ask and how it's going to affect you.
Right.
I think that's really, really important. And we had a situation, and I'm not going to say any names, but we had a provider that I think there was a contract issue.
Yes.
And so there are some things out of our control. What happened was there was no agreement, and it happened midstream. And so some of the members were not able to see some of their doctors because of this disagreement. Things like that are pretty much out of our control.
Right.
But we work toward it, and we work to try to help you get situated with another doctor. But when something like that happens that's out of your control, you don't panic.
Right.
If you are not able to see your regular doctor, if it's like an annual checkup, that's something you could see. You could see just about any doctor for that. If you're having surgery on something specific, that's a little bit different. But I just want to put it out there. Don't panic if something like that happens, because there are other doctors. And another way that you could look at that is, what if your doctor retired and you had to go to another doctor? Nobody wants to change doctors. Don't get me wrong. I don't want to change my doctor. How about you?
No. I'm happy with mine.
But if my doctor retire, what choice am I going to have? Stop going to the doctor or get somebody new? So we were faced with issues like that, and I just want to say that's completely out of our control when that happens. There is absolutely nothing that we can do about that. And so, that's between the provider and the insurance company.
Right.
But we will be there to support you as much as we possibly can in every other way. So get everything ready for your annual enrollment period.
Right. It's coming up.
It is coming up. So what else do we have for Oak Street? Anything else? Anything new coming up?
For Oak Street, no, it's going to take some time for them to have all the all the agreements with the different insurance companies. But it's just also be patient with that. No, don't go and just, change insurances because of that. No. Give them some time to, get all organized, put themselves under all these insurance agreements, find the providers in order to give everybody, a good service.
Yep. So I want to talk to some of the people that signed up on Medicare plans over the phone, okay? Because I had a situation where clients have, I meet them, they having all these problems. I might meet them for life insurance, and then we start talking about, problems that they had previously with the Medicare. So what, I don't want to say change, but if you're dealing with an agent and you don't have this personal care, you live in Connecticut and your agent is in Texas, how are they going to help you when you have a real problem? I'm just asking. Just ask yourself that. So what Alicia and I, one of the things that we're going to be doing, we're going to be leaving information I will be in all the libraries where you can explain it to us, Alicia. You can pull a tab and you have all of our information. What is it?
Well, it's just, it's just our information. You have our name and the phone number, and you just pull the tab, and when you need us, you just give us a call. We're going to be putting this information in the different libraries, and if you have any questions about your health insurance, we'll be happy to give you a hand on that.
I just wanted her to tell you because I haven't seen mine yet. She was going to bring it today, but she forgot.
Sorry about that.
So I didn't know how to explain it because I hadn't seen it. I know I'm going to get it soon. And plus, I really don't need it until October, so it's not the end of the world. I didn't mean to put you on the spot
No,
like
that's
that.
okay.
But I just didn't have a visual of it.
Yeah.
I guess it's like a book, and it has little, you could tear out.
Yeah, it's
you could tear it out, and it
piece
would
of
say
paper.
Benita Lambert,
Yes.
insurance agent. Call me if you need whatever.
Yes,
Okay.
right, that's
Okay.
very
So when I get mine, so if you don't have an agent, getting back to that, I'm gonna post these in
Yes.
all the libraries. I'm gonna put one in Newfield Library, Madison, all over Bridgeport, Stratford, all over the area, and she'll have some too. And especially for bilingual.
Yes.
We'll put both of them in all. I'll put yours and mine. It's thought about that. So if you have a need for an agent or information, it's going to be right there if you signed up over the phone. Because I know a lot of people signed up over the phone
Yes.
or have not seen an agent in 5 years, but we give personal care.
Yes. I just want to give a suggestion to the people who sign up over the phone. Take the number and the name of the person, because if you have questions like, for example, where is my card? Because the card didn't arrive. Where is my catalog? Because it didn't arrive. You can probably have the chance to call that person back, and ask him or her to see, keep track of where your card is or where your catalog is. Because unfortunately, they're going to be the only ones who can help you out.
And if it's an 800 number, and I don't know about you, but I've had a terrible experience trying to track down 800 numbers.
Yes.
You want to try to get a direct number, because when you call an 800 number, in most cases, not all, but in most cases, you're going to get like a customer service center. And every time you call, you're going to get a different person.
Yes.
So the thing that we do, we leave our cards, refrigerator magnets, whatever, and we're right here in the state of Connecticut. And that
Right.
way you can call us if you have an issue. But first you want to, in all the books that we have, they have vendor phone numbers for each category. If
Right.
you have a question about over the counter, you can call that number. If you have questions about logistics, you can call that number, and dental and so on. But if you're unsuccessful after trying, or the customer service number on the back of the card, if you're unsuccessful, then you can call your agent right here in Connecticut, and we're able to help you out with those things,
Right.
or at least
right.
point you in the right direction.
Yes. That's very. It's an advantage really to have an agent.
That's right. We give personal care. We're
Right.
not social workers, but we're Medicare agents, and we try to help you as much as we can. We cannot help you with everything,
No.
but we can help you with your health insurance. And we will be doing the seminars. They're bilingual seminars throughout the Medicare season, which is going to be probably for the next 6 months. From October 15th to December 7th, and then we take a break, and maybe between January 1st and March 31st.
Yeah. Right.
Exactly. So that's it in a nutshell for Medicare. And since it's not Medicare season now, one of the other things that we always like to offer our clients is, and ask our clients is, do you have life insurance? I know that there's a study that was done in Connecticut where 40% of the people in Connecticut did not have any insurance, none at all. If you are one of those people that don't have any insurance, or you may be underinsured, you can give us a call and we will sit down and talk to you about life insurance, all different types of life insurance. If you have insurance, okay, one of the things that you can do is, one things that we can do, I'm sorry, is review the policy that you have. It may be a term policy and it may be expiring soon. And if you're, a senior, if you're a senior, term insurance might not be the best thing for you, because term insurance is temporary insurance. The premiums normally go up, and they normally go up in increments of 20, 10, 5, and 1 year increments. And the reason I went backwards is because the older you get, the more rapidly they go up. And also, term insurance expires. They have an expiration date. The average expiration date is 85. Some of them may go to 90, and I've seen some go to a little bit higher, but depending on when you bought it, the insurance could expire at age 85. And what that means is that all the money that you paid into that policy, there's no cash value out of it because it's term insurance. And so it's good to know what type of insurance you have, and it's also good to know all of the features and all of the benefits. Okay, so we have about 2 minutes left. So you want to say anything? Do you want to translate anything about life insurance, or just a note to call us?
Bueno, sabemos que hay un porcentaje muy grande de personas que no tienen seguros de vida para el sepelio. Es una cosa muy importante realmente dejar algo así organizado para la familia. Piénselo bien. Si ustedes necesitan algo, un seguro de vida, ahí están nuestros teléfonos en la pantalla. Nos pueden llamar, nosotros encantadas de ayudarlos.
Well, thank you very much for joining us this session.
Thank you. Gracias.
Thanks so much for coming, Alicia.
You're very welcome.
And next time we'll have some more information about Oak Street. I can't wait for that. I'm very excited about it. So thank you very much. This is the David Goodman Reality and Truth Show, and we're on your side.